Hafaday and good afternoon. The legislature is back in session. We are now in the second reading file. I'd like to recognize Speaker Tina Rose Munya Barnes.
Sijus Masi, Madam Speaker. Madam Speaker, I'd like to move Bill number 30-35 COR as introduced by myself and as amended by the Committee on Public Accountability, Human Resources, and the Guam Build-Up, which is an act to add Section 4302 F1 of Chapter 4, Title 4, Guam Code Annotated, relative to requiring that all private hospitals be covered under the Government of Guam Health Insurance contract. I'd like to move it to the third reading, and if I can have the opportunity to speak within the timeline set, Madam Speaker.
To discuss Bill number 30-35, Speaker, you are recognized.
Madam Speaker. Madam Speaker, the impetus of Bill 30-35 was very simple. Making sure that we do, as policymakers, what is in the best interest of our hard-working Government of Guam workers and retirees. That we have the opportunity to improve their quality of life, to provide them with better health care coverage, Madam Speaker. We make sure that at the very least, we bring it to this table and discuss it. Under Bill number 30-35 as amended, government employees and retirees will have both hospitals in their health care insurance network so that they can decide for themselves which level of care they can take advantage of. During a life or death situation, no one should have to worry about which hospital they are going to. No one should have to worry about their hospital fees because they were treated in an out-of-network hospital. Many people on our island refuse care, Madam Speaker, going against their doctor's orders because the fear of paying the fees in an out-of-network hospital is greater than the fear of losing their own life. Madam Speaker, I want to note that in no way does this bill work against the efforts of GMH and the hard-working employees or take away from the doctors, nurses, and employees of the hospital. I want to share with you that both hospitals in previous terms, working with them, are meant to coexist and complement each other in certain cases. The government worked hard to bring in additional healthcare services to our people so that they don't have to go off island for treatment anymore, Madam Speaker. They don't have to worry about medical fundraisers and other burdens that families go through to take a loved one to get medical services. And I want to share with you, Madam Speaker, what is the point of these efforts if any insurance contract negotiated in the future may not include both hospitals? I truly believe in my heart of hearts that it should be a fundamental requirement. Madam Speaker, I understand the concerns raised from the bill introduced in the 34th Guam Legislature, and you and I know that one legislature doesn't bound the other legislature, but however, the bill that we're introduced today as amended, this is the bill that we discussed today is completely different from Bill 34, and that Bill 34, the bill in the previous 34th Guam Legislature is not what we are discussing today. In this Bill 30-35, as amended, we are discussing giving our Government of Guam employees and our retirees the power to decide the health care options and to go to where the critical medical expertise is, if it is not provided by our public hospital. Currently, Madam Speaker, more people choose to be covered under a health insurance plan that includes both hospitals in their network. About 84% of the government of Guam employees are covered under a contract, Madam Speaker, that includes both hospitals. Additionally, if we look at our surroundings today, I want to share with you, Madam Speaker, that more people today live around the hospital, the private hospital that is in the north. In an emergency, patients are taken by mandate to the closest hospital, either GMH, GRMC, or Naval Hospital. The odds of our people going to GRMC, Madam Speaker, is very, very likely. If GRMC continues to be out of the network, the patients would have to pay these unnegotiated costs. Madam Speaker, you're going to hear pros and cons about this bill. And I want to share with you that what is important is that we do what we can to take care of our government of Guam employees and their retirees. I want to stress that, Madam Speaker. What we need to do is to take care of our government employees and retirees. So, Madam Speaker, I'm going to respectfully request and humbly ask our colleagues to support this Bill 30-35 as amended, so that we can ease our government workers and retirees' minds about the level of healthcare services that will be available for them from year to year. Madam Speaker, if I may, I just want to note for the record that there was an updated fiscal note that was provided to this body, and I know that all my colleagues and the clerk and the Committee on Rules had received them. So again, I want to thank you. I know that that's within the timeline prescribed to talk about the main motion of this bill, the impetus for why I'd like to ask my colleagues to vote for this bill, and say undanklo na si Diyos Masi for giving me this opportunity to speak. Sainamasi.
Situs Masi, Speaker. Is there anyone else who wishes to speak on the bill?
Madam Speaker, if there's no one who wishes to speak on the bill, I'd like to move it to third reading, voting
I
file.
believe we have someone who wishes to speak on the bill. Senator Marsh, you are recognized.
Madam Speaker, would the author of the bill 30-35 yield to a question? Or will that?
What is your question, Senator Marsh Taitsino?
Is there anything that stops or hinders an insurance company from offering a tiered plan so that choices and competition still exist, even in an exclusionary awarding of a government of Guam contract, should this bill go forward?
Situs Masi, Senator Marsh Taitsino, does the author wish to yield to the question? Can you please repeat the question?
Yes, I'll repeat the question. Is there anything that stops or hinders an insurance company from offering a tiered plan so that choices and competition still exist, even in an exclusionary awarding? So for example, if in Plan A, there was limited coverage that covered a state or local hospital only, but in Plan B, it would be an expanded plan that provided access to a larger group of hospitals and clinics, let's say, in the awarding of a GovGuam contract.
Thank you. Does the author wish to yield to the question?
Yes, I do, Madam Speaker, and with that inquiry, the answer would be no.
Sitio Smasi, does anyone wish to speak on the bill? Senator Perez, you are recognized.
I would like to ask a question of the author of the bill.
Senator Perez, what is your question?
Should Take Care be mandated to be required to include all private entities, hospitals, in their insurance? What are the chances of them pulling out as one of the potential insurance? And what effect would that have if there be only one insurance company providing service for Guam employees?
Senator Perez, can you please repeat the question?
So the question basically refers to the impact. If this mandate goes forward, what impact would that have on the amount of insurance companies vying for GovGuam to supply GovGuam insurance? And if there's only one remaining insurance company, what impact would that have on government of Guam finances?
Thank you, Senator Perez. Does the speaker wish to yield to the question?
I hope I'm understanding that correctly. I think that the risk pool, I want to share with you, Madam Speaker, based on that inquiry, that all but one right now have a negotiated agreement with the hospital, with the private hospital. And I want to share with you that is 84% of the employees at this time.
Sitio Smasi, does anyone else wish to speak on the bill, Bill 30-35? Senator Perez, was the answer satisfied?
Yes, thank you.
Thank you, Senator Perez. Is anyone else? Senator Munya, you are recognized.
Thank you, Madam Speaker. I'm trying to put my thoughts into context here and just try to put things into perspective as to what we're trying to do here and what the author of this legislation is trying to do. And I understand where she's coming from. I, too, have had the opportunity, or not, to choose which facility I wanted to go to. And there were some times where I just didn't really have that choice because it's a matter of vicinity. I was closer to where I needed to go to at the time. And I didn't have to think twice about where I was going. So I understand the author of this legislation. You know, healthcare and medicine just across the nation is just rising, period. You know, we don't have any control over that. The people, you know, we pay for premiums throughout the year, and we deserve that opportunity to choose. And that's the way I feel. I feel like if we're putting our trust in these healthcare providers to provide for us when we need it. And so that's where I stand right now. I want to be able to make that choice if I needed to and not have to worry about how much it's going to cost out of my pocket if it's my loved one and it's more convenient for them to go to a certain facility. I think they should have that opportunity too as well. I think we base our healthcare needs on reputation and trust, and that develops loyalty to that certain provider, that certain doctor. And if I don't have that opportunity to go to that doctor, yeah, that's going to affect how I view healthcare. And I really do think that the more barriers we put on our people, the less chances of them going out to get healthcare. And so for me, if we make it a little bit easier for them for that opportunity, then they should have that opportunity. So I know that this bill doesn't address choices, but it's the next step. And so if it's a matter of life or death, I rise in support of this bill. Thank you, Madam Speaker.
Situus Masi, Senator Munya. Is there anyone else who wishes to speak on Bill 30-35? Senator San Augustine, you are recognized.
Madam Speaker, for my colleagues, I just want to emphasize that number one, some have asked me, what's the fiscal impact? Currently today, the Office of Finance and Budget cannot determine what the impact could be because they're just starting to get together for the negotiation with the Gov Guam of all the insurance company. But I also like to remind our colleagues that number one, the only one private hospital today has a QC. There's only one insurance company that has a QC. And I'd like to see why they can't offer all the benefits to Gov Guam employees to include everybody else on the island. So as far as financial impact, I know that some of my colleagues may be asking, well, what happened last year? I can't talk too much about last year. I can only talk about this year. Right now, the Office of Finance and Budget cannot identify what the financial impact could be, and neither can the Department of Administration because negotiation is still ongoing at this time. Thank you.
Thank you, Senator San Augustine. We will take a 1-minute recess.
Members, we are back in session. Senator Shelton, we are back in session on the motion to place. Senator Shelton, you are recognized, and then Senator Chirlahi.
Situus Masi, Madam Speaker. Thank you very much. And I recognize the importance of this bill and how the author of this bill really wishes to address the access of health care for our people. And I know that it's our duty as policymakers to give the people the best value for their money, taxpayer money. And having read the fiscal note, the new fiscal note provided by the committee, I am very concerned to read in the last sentence of the fiscal note. However, absent additional information from DOA, including data that may be confidential due to the Government of Guam health insurance negotiation process, the Bureau is not able to determine the potential cost impact at this time. And I was able to speak to someone at BBMR, and I understand that the information that's needed to complete this fiscal note is confidential because the current data cannot be released due to the ongoing negotiations. However, if that's the case, I'd like to ask if it's possible for last year's data or the projections from the OPA be used as the available data to come up with a cost estimate. I understand too that this is of course going to be a very rough estimate. It's very difficult to come up with this kind of number and try to predict market forces. But in the absence of an impartial cost analysis that comes from either our office of ROFB or from BBMR, I think that this is a legitimate concern that I hope that the author can address. So, Situus Masi.
Speaker, would you like to yield to the question?
Madam Speaker, I will try. If we're looking at actual numbers as provided to us today, I want to share with you that from fiscal years 2014 to 2019, those numbers were given, 79% of that coming from the government of Guam that would shoulder for this coverage. The employees and the retirees would be paying at a 21% margin. And if you take the total of medical and dental, less the dental, because we're only taking about, we're lessing that from the dental not being included in the medical policy. We're averaging each year from 2014, it was at 72 million. 2015 was at, I hope I'm saying this right, 80 million, and then 90, for 2016, we're looking at $86.1 for 2017. I'm sorry. Yes, for 2017 it would be at 86.9. For 2018, 91.0, and then for 2019, which would be at 93.0. Again, I'm just basing it on an analysis that we received that only reads up to 27 from the OPA, which is the executive summary, which gives from 2014 all the way to 2017. And then with the projections on 2018 and 2019, which we are on now, 2020 could be a negotiated rate down to 83.7, and that would be 83.7 million. Again, I'm just basing it based on what was given and analyzing it from the OPA's report. Did you see that?
Senator Shelton, are you satisfied?
Seduis Masi, Madam Speaker. I think what I'm really trying to ask is that we're trying to determine the cost impact of this bill. So I'd like to request the author, the committee, to ask for BABMR to use the historical data from last year to provide us with an amended fiscal note.
Speaker, would you like to yield to that further question?
Just based on the added provision, Madam Speaker, based on the current law today, based on the inquiry, it will be no cost there will be no cost under the current law, because under the current law, the affected insured would not be able to participate, thereby no increase via the inclusion of GRMC would be there. And again, we didn't do the analysis to that. I'm just, what she was asking based on what was written from the OPA, I got those from years 2014 to 2017 from the OPA. We can take a minute recess if you want us to, Madam Speaker.
Senator Shelton, are you satisfied? Okay. We'll take a brief recess.
35th Guam Legislature is back from recess. Ladies and gentlemen, just based on the inquiries that were asked for from the BBMR, working closely with the Department of Administration, we probably won't get the needed information until tomorrow morning. So we are going to move to recess till 10 o'clock tomorrow morning. We are in recess.